Look at your fingernails right now. Go ahead, hold them up. Take a good close look. Most people think nails are just there, something you clip every few weeks and paint once in a while. But I need you to stop everything you are doing right now, because what I am about to share with you could genuinely save your life or the life of someone you love. I am a cardiologist. I have spent over 2 decades looking at hearts, listening to them, studying them, treating them when they fail. And one of the most powerful tools I use during a patient examination is something that surprises almost everyone. I look at their nails. Not because I am curious about their grooming habits, but because your nails are one of the most honest windows into what is happening inside your cardiovascular system, especially once you pass the age of 60. Today I am going to walk you through 7 nail warning signs that I personally look for when a patient walks into my office. Some of these signs are so subtle that most people have been ignoring them for years without any idea that their heart was quietly sending them a distress signal. By the end of this video, you will know exactly what to look for, what each sign means, when to be alarmed, and most importantly, when to pick up the phone and call your doctor immediately. Before we go any further, if you are new to this channel, I am Dr. Andewala, and I create medically accurate, no-nonsense content to help you live a longer, healthier, and stronger life. Hit that subscribe button right now and ring the notification bell, because the kind of information I share on this channel is the kind your doctor might not have time to tell you during a 15-minute appointment. This is your health. You deserve to understand it fully. Now, let us begin. Why your nails reveal so much about your heart. Your heart's entire purpose is to pump blood continuously to every single cell in your body, from the top of your scalp to the tips of your fingers and toes. That word, tips, is critical. Your fingertips are at the far end of your circulatory system. They are literally the last stop on the line. So when your heart is struggling, when it cannot pump with full efficiency, when circulation is compromised, when oxygen delivery to the tissues is diminished, the very first places to show those signs are the extremities, your hands, your feet, and, most visibly, your nails. After 60, the stakes become dramatically higher. The heart naturally undergoes changes with age. The walls of the heart can thicken, the arteries become stiffer, the valves may not open and close with the same precision they once did. Add to that decades of dietary choices, blood pressure fluctuations, blood sugar changes, and lifestyle factors, and what you have is a cardiovascular system that may be working harder than it should, and beginning to show that strain in places you never expected. Your nails grow slowly. They take roughly 3 to 6 months to grow from base to tip. During that entire journey, they are being shaped by everything your body is going through: your nutrition, your circulation, your blood oxygen levels, your immune activity, and yes, your heart function. Think of each nail as a 3 to 6 month medical diary, growing right on the end of your finger. Once you learn to read it, you will never look at your nails the same way again. Warning sign number 1. Nail clubbing. Let us start with the most well-known and most serious of all nail warning signs: clubbing. Nail clubbing is when the tips of your fingers gradually become larger and rounder, and the nails curve downward over the fingertip like the back of a spoon flipped upside down. The nail takes on what doctors sometimes describe as a drumstick or a watch glass appearance. Here is how to check yourself right now. Press the backs of your 2 index fingernails together, facing each other. Normally, you should see a small diamond-shaped gap between them right at the nail bases. This is called the Shamroth window. If that gap is absent, if the nails come together flush with no space, that is a strong indicator of clubbing. Now, why is this so alarming? Clubbing develops because of chronically low oxygen levels in the blood. When the heart cannot pump oxygenated blood efficiently, or when there is a structural problem with the heart, the body responds over time by changing the blood flow patterns at the fingertips. The soft tissue beneath the nail bed grows and swells. The angle of the nail changes. This process does not happen overnight. Clubbing typically develops slowly over months or years, which means by the time it is visible, there has often been a prolonged period of cardiovascular or pulmonary stress. Clubbing is associated with congenital heart disease, infective endocarditis, which is a serious infection of the heart's inner lining, and pulmonary hypertension, a condition where the pressure in the blood vessels of the lungs becomes dangerously elevated. It can also be caused by lung disease, but in someone over 60 who is also experiencing fatigue, shortness of breath, or swelling in the legs, nail clubbing is a sign that demands immediate cardiac evaluation. Do not wait. Do not assume it is nothing. If you look at your fingers and you think your nail tips have changed shape compared to what they looked like even a year ago, you need to call your doctor and describe what you are seeing. This is not a sign to monitor at home. It is a sign to act on today. If this information is opening your eyes right now, do me a favor. Share this video with someone you love who is over 60. It takes 10 seconds and it could genuinely be the most important thing you do today. And if you have not already subscribed to Dr. Andewala, please do that now. I want to make sure you never miss information that could change your health trajectory. Warning sign number 2. Blue or pale nail beds, cyanosis. Now hold your hand out flat, palm down, and look at the color of your nail beds, the skin visible through your nails. What color should they be? In a healthy individual with good cardiac function and proper oxygen delivery to the tissues, nail beds should be a healthy, consistent pink color. Warm, rosy, alive. What should concern you is when the nail beds take on a blue, purplish, or dusky gray color. This is called cyanosis, and it occurs when there is not enough oxygen circulating in the blood. The bluish color comes from deoxygenated hemoglobin, blood that has given up its oxygen and has not been replenished. When your nail beds look blue or gray, it means blood is not picking up enough oxygen, and that can be caused by the heart failing to circulate blood properly through the lungs, or by severe heart valve disease that is disrupting normal blood flow. Pale nail beds, when the pink is washed out and the nails look almost white or cream-colored, are also a significant warning. Pale nails can suggest poor cardiac output, meaning the heart is not pumping with enough force to push blood out to the extremities adequately. They are also associated with anemia, which itself can stress the heart and contribute to heart failure if untreated. Here is the critical distinction I want you to make. If your nails look slightly pale because your hands are cold, press down on the nail bed for a second, release, and watch. In a healthy person with good circulation, the pink color returns within 1 to 2 seconds. Doctors call this capillary refill time. If it takes significantly longer, 3, 4, 5 seconds or more, that slow return of color suggests poor circulation, and in someone over 60, that warrants a cardiovascular workup. Blue or persistently pale nail beds should never be dismissed as a cosmetic issue. They are your body reporting a circulation problem in real time. If you are seeing this today, write it down, note when you first noticed it, and bring it to your physician's attention at your very next appointment, or sooner, if you have other symptoms like breathlessness or chest tightness. Warning sign number 3, splinter hemorrhages. This one is subtle, and it is the one that most people miss entirely because it looks so innocent. Splinter hemorrhages are tiny thin lines, dark red, brown, or sometimes nearly black, that run vertically under the nails. They look exactly like a tiny sliver of wood has gotten lodged under the nail. Most people who see them assume they got a small injury and do not think twice about it. And sometimes, that is exactly what they are. A minor trauma to the nail, like bumping your finger or doing heavy manual work, can cause a small capillary under the nail to break. But here is the difference between a benign splinter hemorrhage and a dangerous one. Location and context. Traumatic splinter hemorrhages from physical impact tend to appear on only 1 or 2 nails, usually near the tip of the nail, and they tend to show up after you have done something physically demanding with your hands. When splinter hemorrhages are associated with heart disease, specifically with a serious condition called infective endocarditis, they tend to appear on multiple nails at once, are typically located in the middle or lower portion of the nail, and they appear without any history of trauma or injury. Infective endocarditis is an infection of the inner lining of the heart or its valves. It is a life-threatening condition that requires immediate hospitalization and often prolonged intravenous antibiotic treatment. When bacteria enter the bloodstream and settle on the heart valves, they form clusters called vegetations. Tiny pieces of these clusters can break off and travel through the bloodstream, lodging in small blood vessels throughout the body, including those under the nails, and causing these characteristic hemorrhagic streaks. If you are over 60, if you have a known heart valve condition, or a history of rheumatic fever, or any previous heart surgery, and you are now noticing dark streaks under several nails that appeared without any injury, do not wait. This needs urgent medical attention. Infective endocarditis, if untreated, can destroy heart valves and become fatal. The earlier it is diagnosed, the better the outcome. Please, if you are getting value from this video, take a moment right now to like it and leave a comment below telling me which nail sign surprised you most. Your engagement helps this channel reach more people who need this exact information. Now let us keep going because the next sign is one I find in my patients more often than any other. Warning sign number 4, Terry's nails. Terry's nails is a condition where most of the nail appears white, a flat, frosted, ground glass white that covers about 80 to 90% of the nail, with only a narrow strip of normal pinkish or reddish color at the very tip of the nail. The lunula, that small white crescent at the base of a healthy nail, disappears entirely when Terry's nails are present. This nail change was first described in 1954 by a physician named Richard Terry, who noticed it was extremely common among patients with liver cirrhosis. But in the decades since, research has firmly established its association with congestive heart failure as well. When the heart is failing, when it cannot pump blood forward efficiently, fluid backs up in the body. Pressure builds. The circulation to the tiny blood vessels in the nail bed is altered. Connective tissue overgrows. And the result is that characteristic white, ground glass appearance. Terry's nails are considered a marker of serious systemic disease. If you look at your nails right now, and they appear predominantly white, not from nail polish, not from a fungal infection, but genuinely white from the inside, and if that narrow pink strip at the tip is the only color you see, this is something your doctor needs to know about. It is worth noting that Terry's nails can occasionally appear simply as part of the normal aging process in older adults. So not every person over 60 with whitish nails has heart failure. But, and this is important, in the context of other symptoms like ankle swelling, unexplained fatigue, shortness of breath when lying flat, or a new inability to climb stairs without feeling winded, Terry's nails take on a much more urgent meaning. If you have Terry's nails along with any of those symptoms, please do not delay seeing your physician. Congestive heart failure is a manageable condition, especially when caught early and treated with the right medications and lifestyle changes. The longer it goes undiagnosed, the more damage accumulates. Early detection changes outcomes dramatically. Warning sign number 5, Bow's lines. Run your fingernail gently across the surface of your other nails. Do you feel a groove, a ridge, a dip running horizontally across the nail? That horizontal groove has a name. It is called a Bow's line, named after the French physician Joseph-Honoré Simon Bow, who described it in 1846. Bow's lines form when the growth of the nail is suddenly disrupted and then resumes. Think of it like a pause in the nail's growth. That pause creates a visible valley in the nail. Whatever caused the body enough systemic stress to halt nail growth will show up as a line, and because nails grow at a known rate, roughly 1 millimeter every 6 to 10 days, a skilled clinician can actually estimate when the disrupting event occurred by measuring how far that line is from the nail base. What causes Bow's lines? Severe illness, high fever, major surgery, significant nutritional deficiency, and critically, cardiac events. Heart attacks can cause Bow's lines. Significant episodes of cardiac decompensation, moments when the heart suddenly fails to keep up with the body's demands, can disrupt nail growth profoundly enough to produce these grooves. Here is what is particularly valuable about Bow's lines from a clinical perspective. They can appear in someone who had a cardiac event and did not fully realize what happened. Some heart attacks are what we call silent. They occur with minimal chest pain, sometimes none at all, particularly in older adults and in women. The person may have felt unusually fatigued for a few days, or experienced what felt like a bad bout of indigestion, and then moved on. But weeks later, a Bow's line appears on their nails, recording that something significant happened to the body at a specific point in time. If you see a horizontal groove running across most or all of your nails at approximately the same position, do not ignore it. Think back 4 to 8 weeks. Did you have an unusual illness, unusual fatigue, any episode of chest discomfort, jaw pain, or arm heaviness that you dismissed? Bring your nails, literally, to your next doctor's appointment and point out that line. It is evidence. It is a recording of what your body went through. Warning sign number 6. Koilonychia, spoon nails. The word koilonychia comes from the Greek words meaning hollow claw. It is a striking change in nail shape where instead of the normal gentle outward curve of a healthy nail, the nail becomes thin, flat, and then concave, scooping inward like a small spoon. If you placed a droplet of water on the nail bed of someone with koilonychia, it would sit there without rolling off. The most well-established cause of koilonychia is iron deficiency anemia. When the body does not have enough iron to produce adequate hemoglobin, the nails become fragile and lose their structural integrity. They flatten. They scoop. And this matters for your heart because iron deficiency anemia places a significant and direct burden on the cardiovascular system. Your heart pumps blood to deliver oxygen to every tissue. Oxygen is carried by hemoglobin in your red blood cells. When hemoglobin is low because iron is deficient, your blood literally carries less oxygen per milliliter. To compensate, the heart must pump faster and harder. It has to circulate more volume of blood to deliver the same amount of oxygen. Over time, this chronic increased workload can lead to an enlarged heart, an irregular heart rhythm, or full cardiac failure, particularly in someone over 60 whose heart may already be working closer to its limits. Spoon-shaped nails in an older adult are therefore not just a cosmetic curiosity. They are a signal that anemia may be present, and that anemia may be silently taxing the heart. A simple blood test can confirm iron deficiency anemia, and it is one of the most treatable causes of cardiovascular strain. Do not overlook it. I want to pause here and remind you, if this video is giving you a new understanding of your own health, please share it. Send it to a parent, a sibling, a friend over 60. You might be the reason they catch something early. And subscribe to Dr. Andewala if you have not already. Every week I put out content that is exactly this level of depth and honesty about your health. Warning sign number 7. Yellow nail syndrome and slow-growing thickened nails. The 7th nail warning sign is one that most people have never heard of, and yet it is one that carries significant clinical weight. Yellow nail syndrome is a condition where the nails become thickened, excessively curved, and turn a distinct yellow or greenish-yellow color. Nail growth slows dramatically, sometimes stopping almost entirely. The cuticles may disappear. The nails may even detach from the nail bed. Yellow nail syndrome is associated with a triad of conditions: lymphedema, swelling caused by problems with the lymphatic system, respiratory problems, and pleural effusions, fluid that accumulates around the lungs. But it is also recognized as a marker of cardiovascular disease because many of the same conditions that compromise heart function also affect lymphatic and pleural fluid dynamics. Congestive heart failure, in particular, can cause fluid to accumulate in and around the lungs, and the chronic lymphatic dysfunction that accompanies heart failure can manifest in the nails in this striking yellowed way. Beyond yellow nail syndrome, I also want you to pay attention to any unexplained changes in how fast your nails grow. Healthy nails grow at a predictable pace. When blood supply to the extremities is chronically reduced, as it is in peripheral artery disease, which frequently coexists with coronary artery disease, Nail growth slows noticeably. The nails may become thicker, brittle, and difficult to cut. If you have noticed over the past year or two that your nails seem to grow much more slowly than they used to, and that they are thickening and becoming harder to manage, mention this to your physician. It is a quiet but real marker of peripheral vascular compromise. Putting it all together, what you should do right now. Let me give you a quick practical checklist. Go through each of these checks deliberately and honestly. First, look at the shape of your fingertips and nails. Are the fingertips enlarged and rounded? Do the nails curve downward? Check the Shamroth window test. If the diamond gap is absent, that is a red flag for clubbing. Second, look at the color of your nail beds. Are they pink and healthy, or are they pale, bluish, or grayish? Press down on the nail bed and time how quickly color returns. Third, look under your nails closely, in good natural light if possible. Do you see any dark red, brown, or black streaks running vertically that you cannot attribute to any injury? If multiple nails are affected, that demands urgent attention. Fourth, look at the overall color of the nails. Are they predominantly white with only a thin pink strip at the tip? That could be Terry's nails. Fifth, run your finger across the surface of your nails. Do you feel any horizontal grooves or ridges running across the nail? That could be Bow's lines, marking a past cardiac event. Sixth, look at the shape of your nails from the side. Are they flat or concave, scooping inward like a spoon? That could be koilonychia, pointing to iron deficiency anemia. Seventh, look at the color and thickness of your nails overall. Are they yellow or yellowish-green? Have they stopped growing normally? Have they thickened unusually? Now here is what I need you to understand about this list. Any one of these signs in complete isolation, with no other symptoms and no cardiac risk factors, may have a benign explanation. Nails can be affected by many things: thyroid problems, nutritional deficiencies, minor infections. The alarm bells get louder when you are over 60, when you have known risk factors like high blood pressure, diabetes, high cholesterol, a family history of heart disease, or a history of smoking, and when these nail changes are accompanied by other symptoms: fatigue that is new and unexplained, shortness of breath with activity that was not there before, swelling in your ankles or feet at the end of the day, occasional dizziness or heart palpitations, or chest discomfort that you have been chalking up to stress or indigestion. When a nail sign appears alongside any of those symptoms, you need medical evaluation. Not next month. Not at your routine annual physical if that is 3 months away. You need to call your physician and say, "I have noticed a change in my nails, and I am also experiencing some symptoms that concern me. I would like to come in." What happens at the doctor's office? When a cardiologist examines your nails, it is always part of a broader assessment. No cardiologist diagnoses heart disease from nail changes alone. What your nails do is provide a piece of evidence, a clue that prompts deeper investigation. Depending on what is found, your physician may order an electrocardiogram to check your heart's electrical activity, an echocardiogram to look at the heart's structure and pumping function, a complete blood count to check for anemia, blood tests to assess kidney function and liver function, and possibly a chest X-ray or CT scan to look at the lungs and the size of the heart. These tests are not scary. They are information, and information, gathered early, is what allows conditions to be treated before they become emergencies. Congestive heart failure, caught in its early stages, can be managed with medication, dietary changes, and structured exercise. Anemia, caught early, can be treated with supplements or dietary adjustments. Infective endocarditis, diagnosed before it causes valve destruction, responds well to antibiotics. Peripheral artery disease, identified early, can be managed with medication and lifestyle intervention to prevent heart attack and stroke. Early detection is not just better, it is the difference between manageable and catastrophic. Lifestyle steps to support your heart, starting today. While we are here, Let me give you 5 things you can start doing today to support your cardiovascular health, because knowledge without action is just entertainment. First, if you smoke, please, I am asking you sincerely as a physician, commit to stopping. Smoking accelerates every cardiovascular risk factor simultaneously. It damages vessel walls, promotes clotting, reduces oxygen delivery, and accelerates the very same processes that produce the nail changes we discussed today. Second, manage your blood pressure. High blood pressure is the silent destroyer of the aging heart. If you do not know your blood pressure numbers, find out this week. A home blood pressure monitor costs very little and could save your life. Third, move every day. Walking 30 minutes a day at a brisk pace is one of the most powerful cardiovascular medications in existence, and it costs nothing. It improves circulation, strengthens the heart muscle, reduces inflammation, and helps manage blood pressure, blood sugar, and cholesterol simultaneously. Fourth, reduce sodium. The typical older adult consumes far too much salt, and excess sodium is directly responsible for fluid retention, elevated blood pressure, and increased cardiac workload. Read labels. Cook at home more. Your heart will feel the difference within weeks. Fifth, do not skip follow-up care. One of the most dangerous patterns I see in my older patients is the tendency to avoid the doctor because they are afraid of what they might find out. I understand that fear, but here is the truth. Finding a problem early is never as bad as finding it late. Your heart is worth knowing about. A personal message to you. I want to close this video with something personal. In over 2 decades as a cardiologist, the cases that have stayed with me the longest, the ones that keep me awake, are not the complicated surgeries or the rare diseases. They are the preventable tragedies. The patient who had signs for months and thought nothing of them. The family member who noticed something and did not know whether to worry. The person who kept putting off the appointment. Your nails are small, but the signals they carry are not. Your body is extraordinarily intelligent. It is constantly communicating with you through your skin, your nails, your hair, your energy, your breath. The question is whether you are listening. Today, you are listening. That matters. Go look at your nails right now with everything you have learned. Check your family members' nails. Be the person in your circle who knows this information and acts on it. If even one person watching this video catches a heart condition early because of what they learned here, then this video has done its job. If this video helped you, please give it a like. It takes 1 second, and it tells YouTube that this content is valuable and worth sharing with more people who need it. Leave a comment below and tell me which nail sign you had never heard of before today. Subscribe to Dr. Andewala and turn on your notifications so you never miss a video. And please, share this with someone you love. Your heart is the engine of everything you are. Treat it with the attention it deserves. I am Dr. Andewala. Stay heart healthy. I will see you in the next one.